Talk about pediatric renal vascular hypertension, same format, and we have a 10-year-old male. He went in to have his adenoids removed, and they found his blood pressure was 166 over 112. He was sent to hypertension clinic, and it was 134 over 86, which sounds great, except for that's greater than 99.6 percentile for age. So it's terrible for him. He had symptoms of lethargy, and that was only it. He was on 4 medications through the hypertensive clinic, and he was still hypertensive, so he wasn't doing any better. He had this ultrasound exam. Again, I give you one picture of thousands. You should thank me for that. Had a CT angiogram. Has arrows. Had this study. And then had this study. So let's go to the question, which is true that neurofibromatosis type 1 is the most common cause of hypertension in children. B, most renal artery stenoses in children are of intrarenal branches. C, renovascular hypertension associated with Williams syndrome rarely involves the aorta. D, overdilatation of pediatric renal artery stenosis is preferred due to the better clinical results. Or E, routine stenting after renal angioplasty is recommended in children. You can vote now. All right. Good. I wasn't sure where that check mark was on between the two. All right, back to slides, please. All right, so radiographic findings. We had a tardus et parvis pattern in the inferior aspect of the right kidney. The examination was otherwise normal. It's actually not the worst one I've ever seen, but that's what it was called. We did a CT angiogram, and I'll talk a little bit about that later. It showed an aneurysm in the lower aspect of the right kidney with the arrow pointing at it. Renin levels were done. We can talk about that a little too. The right was 2100 while the left was 329. So it localizes pretty well. And the angiogram showed a severe stenosis of the inferior right renal artery with a poststenotic aneurysm. We can see here, I think one of the things I think is most striking about it is just incredibly poor perfusion of this aspect of the kidney compared to the rest. And you can just see actually how tight that stenosis was, that little pinhole right there. So we gave him heparin, 75 units per kilo, nitro, 1 mic per kilogram. We give up to a max of 25 mic.